Good evening, everyone. My name is Owen Mbundu. I'm head of marketing. Can I just ask, my contribution here is going to be very short. And one of the things I was asked to do is just some housekeeping rules for you to put your cell phones on silent. You are allowed to tweet, but let's just keep that on silent. Also, a welcome to our people that are dialed into our streaming service. Not everyone could make it, so a lot of people are dialing in, and we're streaming this information session. I'll be very brief. This morning, driving into work, I thought about today's event, very special event for us, and you'll soon understand why. But just driving in this morning, I reflected on activities at the business school for the last at least 3-4 months, but in particular this week. Why? Because we had a visit by one of our accreditation bodies, MBA, and the MBA looks at, in particular, the MBA qualification. And it's my first, and I was astounded at the rigor that goes into an accreditation. They are thorough and they ask detailed questions. Not only do they ask questions to the academy, in other words, the academic staff, they also come to us, and everything that we put into a self-assessment report is then checked. So it's very rigorous, and they then hold us to very high standards in order for our to get our accreditations. USB is sitting with 3 accreditations, and in October we are having another visit. So whilst MBA looked at the MBA, the AACSB look at very different criteria. So they come at the school from an auditing point of view, they come at the school from a very different lens. And in 2019, the 3rd accreditation body comes, and again, they look at the school from a very different lens. I think when you put the 3 together, I am very confident when I say, and without any fear of contradiction, that our MBA is a world-class program. So you are at the right place. Over and above that, we have our own standards. We continually look at improving, and tonight is a culmination of probably 3 years of really hard work. This is the 3rd specialization we're launching. The first one was postgraduate diploma, business and administration, business and management administration, with a clear focus on the higher education sector. So much like this program, there are core modules and electives that focus on the higher education sector. Very niche program, but if you understand the turmoil that our higher education sector is in, you understand why there's a need for such a program. The second one we launched is again off the MBA program. So it's a master's level program, and that we got approached for by the United Nations staff college based in Italy, and where they had a choice of, I don't know, thousands of business schools, they decided to approach us to put a program together. And that program we launched, I think, just over a week ago. This is the 3rd one. And again,
and the final one for now.
Yeah, the final one for now. And again, if you understand South Africa, you understand why this particular one is so important. I think, for me, the message is quite clear. At any given time, because of all these rigorous processes that we go through and accreditation process we go through, this school, what these bodies do, they point out your strengths, and we celebrate those, but they also point out areas of development. So at any given time when you approach or come to the school, there is an improvement process going on. And that's a fantastic environment to operate in, but also a very demanding place to work at. But what it tells, or should tell you, is that we always strive to improve. We are a decent school, but there are always areas of development. Just for tonight, in terms of program, we're going to first listen to Martin Butler, who is the head of our program, the MBA program. Martin Butler was one of a team of 3 that helped us get through the accreditation process. And there on my far left is Professor Mani de Klerk, also a very unique person. Mani is one of those few people who managed to straddle both industry and academia successfully. The plan is not to keep you for very long. We want to finish here by 7. We are streaming this thing, as we said, the information session. So when you ask a question, we will come to you with a mic. So always speak into the mic so the people on the other side have the benefit of your question. And then thereafter, we will engage with you more on a one-on-one level. I've got one of my team members, Marie Willows, at the back. Marie has been with the USB for a while, and she will answer or respond to very detailed questions about the application process and requirements and so on. We want to make sure that we don't treat any of your applications as a number, and we have people like Marie to make sure that you get a very personal experience with us. I now hand over to Martin, who's going to speak to the MBA at a generic level, and then Mani will speak, who is coordinating the stream for us. Mani will speak to the specifics around the stream. Over to you, Martin.
Thank you, Owen. I think I am mic'd. I hear myself. I don't know if it's over here or over there. Good evening, ladies and gentlemen. Two factors that will help us along. When Owen said we will be done by 7, I saw 2 of our current students at the back making eye contact and saying that's not quick enough. So specifically for you, we'll make it 1 minute before 7. And then when I sat down and I saw everybody was having wine, I asked if I could have a glass of wine, and they said afterwards. So that may cut another minute or 2 off our program tonight, unless you offer me some of yours, Johan. As Owen has said, I'd like to talk very quickly about the USB. It's a standard that we would always share about the school. Tonight in the audience, I see graduates of the school and friends of the school. I see current students in their first year, which already cornered me in a classroom 2 weeks ago and said, can I now move over to this stream, seeing that I'm a first year student, which is one of the first questions that we will probably get. And then I see a fair amount of prospective students as well. I'm going to talk about the USB quickly because for some of you it may be boring, but for others it's important to know who we are, and I'll build a little bit on the accreditation that Owen talked about. And then I will very briefly talk about the MBA in general. And the reason for that is that you would still enroll for the MBA program. It's still the enrollment process. So it's everything that's associated with an MBA enrollment. The student enrolling for this particular stream and the other stream will go through the same process you do. So I will cover the generic basis, and then I will hand over to Mani, and he will go through the more detail. And any of the questions afterwards as well. I'm fairly comfortable in terms of the enrollment process and all of those things. But Mani has been fundamental, and we have literally now concluded a contract to keep him tied into the business school for a long time, because as Owen has said, he's straddling academia and industry successful for a while, and he has graciously agreed to manage the stream on our behalf moving forwards as well. So a lot of this was part of his vision, his energy, and Mani, a little bit of tenacity and not letting us leave it. He came to us and he said, we're going to do this.
It wasn't too difficult, yeah.
It wasn't too difficult, but
lot of support.
yeah, there was a fair amount of support. Okay, so ladies and gents, very briefly, the USB as an institution, we always have to start with our vision and mission, but there are important attributes of this. For us, we want to be globally distinguished as the business knowledge partner in Africa, so it's very important that we depart from a sound theoretical base. You'll also see towards the end of the program on the healthcare leadership, we envisage doing research in that particular space. Johannes from a very prestigious industry partner not too far from here, and they have some challenges there, and it is envisaged that some of our students may actually build on this business and then in this particular field. And then our mission is to develop responsible leaders. And I had an interview today where they asked about what are the defining attributes of our program, and Owen, I think it manifested in our accreditation as well. Irrespective of whether we will have specializations in the international organizations, leadership, or our generalist MBA, responsible leadership remains a core on our MBA program, and in actual fact at the business school. So, and in a very challenging industry, in a very dynamic industry, you still have to make very good decisions and display responsibility towards the society, the industry, and many of the challenges that we're sitting. And then well-bounded, grounded business education and research. And there was a fair amount of debate around this well-grounded. Why well-grounded? And the principle that we depart from the USB is to say you could always have a conversation based on very little fact. In an era when we deal with fake news and people have very strong opinions based on little fact, it's rather important for us in the business school to respect the theory, to respect the knowledge that sits within a particular industry, to respect the facts of the society in which we are sitting, and then we can have a well-grounded conversation. And I think that's the one thing that defines our programs as well, and I think it's an aspiration for us as well to make it stronger. Says we can open anything up for a conversation, and we will gladly tackle anything, but we're not starting from a zero base. We are respecting what is there, and if there are holes in terms of the research and what we know, then that's our role as a business school as well. It's not just producing graduates, it is finding out. And I think in the healthcare industry in particular, it's a very innovative and fast-moving industry, but it's also going through some fundamental changes at the moment, and I do think there's some interesting research to be done there. So that in a nutshell is our aspirations and our execution of the aspirations. Of the values, I want to highlight one value, and that's the value of innovation. Mani graciously said that it wasn't that challenging to get us to launch a new program. But we looked at our values, and although all these values are important for us, we said, well, if we truly want to be innovative, surely this is something that we should look at. And as we travel the world, and Owen and myself, when we look at MBA markets globally as well, we understand that there are industries and there are sectors that ask for some specialist knowledge. And if we truly want to be an innovative school, we need to think about how do we deal with this. Now, why the USB? I'm going to highlight 5 things, which is slightly old news for some of you. But the accreditations I will allude to, the focus on leadership again, client engagement. I think tonight is an example of doing things slightly different from the norms that you would sometimes find, a global perspective, and then finally an African context. So Owen alluded to the accreditations. The easiest way to think about this, if you're not entirely sure, is in industry you quite often go through an ISO accreditation. And an ISO accreditation would then open yourselves up to scrutiny from external parties, and those external parties would come and they would signify that you are indeed executing the processes and producing the products and the services as stated. There are 3 of these accreditations globally that truly count. There's a 4th emerging within the East Bloc, and we're contemplating that, but globally the term that they talk about is triple accredited business schools. And of the 16,000 business schools, depending on whom you speak to, between 16 and 18,000 business schools in the world, there's only 89 that are triple accredited. I have to put it in context. The Ivy League schools are not triple accredited. If you are Harvard and an MIT Sloan, then you don't have to do triple accreditation because you get 1,000 applications for every student you let in. So outside of the top 10 to 20 Ivy League business schools in the world, the rest all aspire towards triple accreditation. And as Owen has said, we've recently gone through 1 re-accreditation and another one this year as well. And for us, that's the best measure of success there is. We're part of a network of top business schools. For example, when we started designing this, we need to find the destination to take the students on the healthcare leadership program internationally. And we immediately did a nosedive into our network, and two of our partners emerged. The first one was Temple University Fox Business School in America, which has the #1 online ranked MBA in America and a top MBA program, and they already indicated that they would love to receive USB students. And the second one is Galway Business School in Ireland. Now, I have to admit that I'm leaning towards Ireland because my affinity for pinotage is only matched by my affinity for Guinness. But it's also a very interesting destination because of the innovative healthcare industries that is around healthcare. So although Galway Business School is not necessarily of the same esteem as Temple University Fox Business School, it would be very interesting for us as a destination to take students on this program. So that's part of our networks. And then finally, Stellenbosch University. There are enough measures to measure universities. There are global rankings, but one of the measures of success is your research output. Stellenbosch does not produce the most research output in South Africa. So if you look at the research produced in South Africa, the sheer quantity of research, we're actually sitting in the 3rd position. But if you divide that by the full-time equivalent of faculty, we are the top research university on the African continent. So although we don't produce the most research in South Africa, we're sitting in the 3rd position. By full-time faculty member, we are the top research university on the continent. So I think that says something about our reputation. The second attribute is leadership development, and you will see that manifest in our MBA program. And it's a very strong focus. And when the AMBA panel gave us feedback yesterday afternoon, it was 5 o'clock, they indeed confirmed that although we stated explicitly and we focus on that, when they spoke to our alumni and they spoke to current students and they spoke to employers which employ our MBA students, they said the focus on leadership and responsible leadership came through very, very strongly as a school, and it's something that we are not willing to move away from for specialization. We believe that it is core to whatever industry that we are moving into. Third one is client engagement. I had the privilege to do a session like this twice last week in KZN. We always say certain things, and where's Maury now? Maury is sitting over here. And Maury always says we have a slightly different way of doing things at Stellenbosch. I had a student confirming that to me last week, Maury, a student that went to one of our big competitors in Johannesburg and said, it's different. There's a different way in which you engage. And this afternoon I admitted to our MBA program a student that studied not too far from here, and she also commented on we do things different. Now I want to be clear, I think there are 3 or maybe 4 very good business schools in South Africa, there's no doubt about that. But you need to find a personal fit. Ultimately, whether you buy an Audi or a Mercedes-Benz or what is that, BMW or a Lexus, there's a, am I back? I'm back. So whether you buy one of those 4 vehicles, there's a fair amount of personal, thank you, Owen. I just heard that you were beeping the whole time, so I think it may be the battery in this one. IT, come in, please replace my battery. No, my remote's battery. Okay, so there we go. So, you need to be comfortable with the institution that you select. And I do think our client engagement is different. Our classes most definitely are smaller, we know that. Our faculty don't have a distance from our students. We don't walk into the passages, and although it is Professor Mani de Klerk and he worked extremely hard for that title, he's not going to erect 10 barriers and ask you to go to your knees and first say to him, "Dear Dr. Professor de Klerk." That's not the way we work at University of Stellenbosch Business School, and we also try to work closely with industry and bring the industry into the classroom and take our students to industry. And I met Johan that I'm seeing in the front row a couple of weeks ago where we reached out to each other because they're doing something very interesting in the industry, and we think our students should be exposed to that, and they think that there's some value to be gained from that. Ladies and gents, the second last attribute that I would like to highlight from the business school is our global perspective. I've alluded to this in terms of the accreditation and our partnerships and networks. Our faculty teach at top business schools, so our faculty go and teach everywhere in the world, and we also host faculty from business schools all across the world. So currently at the business school, we've got faculty from, I think, 4 different African countries: Ghana, Nigeria, Tanzania. Where's the 4th one? I can't remember, but there's one somewhere. Faculty from Europe. Yeah, I'm not too sure. And then we also have lots of faculty coming in, and it will probably be the same on this program as well. If we find expertise anywhere, we will most definitely bring those expertise into the program. And then our students are increasingly internationalizing. When we did an event like this, I didn't have to be mic'd and sit upright and be very careful of what I'm saying. I could just profess my love for pinotage without any fear of retribution. But tonight I must be very careful, and I will never use the word pinotage in a presentation because it's streamed and it's recorded, and it could be used against me in evidence in a couple of weeks' time. So our students are not just the students sitting in front of us, but they are spread over the continent and beyond as well. And you will see the interesting way in which we deliver this program is that we take cognizance of that, and we actually allow you to follow different modes of study initially, and then finally, although we say it's a blended, it's actually a combination of blended and modular, as there are resident blocks and there's a blended one. And that's just recognizing that although we grew from a regional school to a national school, now to a continental school, we have more growth aspirations, and we trust that this program will attract students from further as well. The final aspect is the African focus, and I think the African focus is very important for us as a business school. You will find it in our vision. You will find it on students from the continent, 19 different students from Africa studying at the business school at this point in time. Faculty from the continent, the end of this year in our current MBA program, electives, faculty from 5 different African countries being invited to come and teach on our electives, top-notch scholars, and from about another 15 countries across the world as well. So we're very proud to be an African school, and you will find it embedded in a lot of what we're doing. And for interest, we have a focus on leadership. And somebody commented to me last night that the person on Twitter with the most followers is Donald Trump, which as an indicator of how terrible social media is. And I had to respond to say, yes, but the most tweeted tweet on the internet is from? You've just failed your first question for the entrance test, but you can listen. Nelson Mandela. A tweet that Barack Obama tweeted from Madiba's book is the most tweeted tweet on the internet. So for every Donald Trump, there's a counter argument as well. And in leadership, when we focus on leadership development, we most definitely look at cases from the African continent, because we don't have to jump over the ocean to find examples of brilliant leadership. Sadly, very poor leadership as well. Ladies and gents, the program portfolio, that's the school. I'm wrapping up by just sharing a little bit of detail on the program portfolio. That's our entire portfolio of programs. And tonight we are here to talk about that one particular block there, the MBA program. And in the MBA program, we now have the 2 specialist streams. We talk, the narrative that we will use is a generalist program. So we always just talk MBA. That will slowly change to a generalist MBA. And a specialist MBA, of which we have 2, and we probably have plans for other specializations as well. Now, on the MBA program in general, so I'm not talking about the MBA program, the admissions requirements, that is the same for this stream, exactly the same. The differences I will hand over to Mani, and you will go into the differences. So firstly, you need to have 4 years of formal study. So that would mean a 4-year or lengthier degree. So any 4-year degree, of which most of the degrees in healthcare sciences are 4-year degrees, but that includes a theology degree, a music degree, and an engineering degree. If you have a 4-year degree, 4-year B degree, you're allowed to start with an MBA in South Africa as of 2016. Or if you have a 4th year of study following on a 3-year degree. So if you did a 3-year degree, a typical BCom degree, you need to have a 4th year of study. Now that used to be called in South Africa an honours degree. It's only in South Africa, it's only in the UK and in former British colonies that people actually know what an honours degree is. In the rest of the world, if you say I have an honours degree, they have absolutely no idea what you're talking about. They talk about postgraduate diploma. So rest of the world, you have a postgraduate diploma, which would signify your 4th year of study. It's exactly the same thing as an honours degree, and South Africa is migrating across to global standards on that. But in essence, you need an NQF level 8 qualification. And if you have a general question, you're welcome to pop it afterwards. But if you have a specific question, because sometimes students will say, I have done 17 one-year courses, or I have done this, or I did this, or I did half a course in Kazakhstan, and then the other half in Uzbekistan, and afterwards I did via Pigeon the missing module. So that's Mari's role. Mari is absolutely brilliant in dealing with all your subtle nuances in your academic career up to date, and she has all of the details. 3 years work experience is mandatory. We're not allowed to take students without 3 years work experience, and it's part of our MBA accreditation. Essays, when you apply, you have to write 3 essays, and the essays are very clear. It's about where you are at the moment, where you aspire to be in the future. And then on the selection test, we accept 2 different selection tests. The global de facto standard is the GMAT, but I can keep you entertained for hours on the conversations around the GMAT, and GMAT has now launched a new test, the NMAT, and there's a new global competitor. The GMAT test is still, by a distance, the most widely used admission test for business schools all across the world, although it is not flawless. What we see when students consider multiple business schools, they quite often go for the GMAT, so I know when I get an application and there's a GMAT, student is looking at multiple schools. If you're only looking at Stellenbosch, and there are 1 or 2 other schools in South Africa, we take the SHL test. Now, the SHL test is slightly more cost effective, but there are certain things that we like about the SHL test. The SHL test, firstly, you don't have to go to a test center, so the SHL test can be done online, but we have on-campus verification tests if there's anything that we pick out. And there's also a battery of personality test included in the SHL test that we then use for the personal leadership development. So when you come onto campus, you have a one-on-one session with faculty, there are certain attributes that's included in there. And then we also have a success predictor, which we look not just at the verbal, numerical, inductive reasoning skills, which is tested by both SHL and GMAT, but also in terms of certain traits that tell us about success. And that helps us also in terms of the SHL. So that's the reason that we prefer the SHL test. But there is zero difference for us in an application between SHL and GMAT. So don't worry that if you write GMAT, we're not going to accept you, but if you write SHL, we accept both tests equally. And ultimately, we triangulate between where you find yourself in your career, how your career progression is going well, how you did it at pre-grad level, what the entrance tests are telling us, what you wrote in your essays, and what we learn from you as an individual. And if there's any doubt in our minds, the student I admitted this afternoon, I invited her for an interview because I looked at all of this information, and one of the attributes I was uncertain. I said to her, please come and have a conversation. And you will meet with the academics, and they will sit with you, and they will ask certain questions. And if I'm really, really worried, well, I'll get our local expert in the room. Thank you, Janine. And then Janine will sit with me, and we will have an in-depth conversation. We will put some electrodes on your head. We will probe you. We will do an EKG in English. Is it as simple as a ECG? Oh, no. We don't do all of that. But we don't have hard lines where we draw a line. We like to meet with the students and probe in terms of why you want to study with us. And then finally, a comprehensive CV. So yes, if you were the captain of the under 11B soccer team, you could put that on the CV. But we are looking specifically at your business experience. So we would like to know your business experience. And in this vein, and I sometimes say an MBA is not magic fairy dust. An MBA is not something that you sprinkle across a person and then they magically jump from an operations level to an executive level in an organization. An MBA is an accelerator. And an MBA is an accelerator of your career. An MBA is where you, in a short period of time, are exposed to a significant amount of information, some tough learning, and things that would typically take you a decade or 15 or sometimes 20 years to pick up in the business world to groom you for that level. You now pick up in a much shorter time period. And that's why we look at the CV as well. If we see a person is 55 years old and they're still sitting at a very junior level in an organization, it means that maybe they did not necessarily have the traits that would make them top level management in an organization. However, if you're a specialist and you're sitting in a very particular field, I remember a couple of years ago, I had a couple applying to study with us. The one was a theater nurse. The lady was a theater nurse, so from what we would call a management experience on her CV, nothing. And the husband had a master's degree in engineering. He was a mechanical engineer with a master's degree in engineering. And I remember having an interview with her, and in the interview I said to her, tell me about how you deal with stress and tell me about management. And about 15 minutes later I said, okay, that is a question I'm not going to ask again. Because if you sit in that particular role, you really know about stress. And you are really, really, really managing. And the beautiful part is she kicked his butt in the studies. She did better than him on the MBA. We admitted both.
And they did both fairly well, but she was always a percentage or two ahead of him, and he was sitting in a management position after having completed a master's degree. So we have also learned to be very thorough in our admissions process. Ladies and gents, the program options, full-time, modular, and blended. I'm not going to talk about the full-time because the full-time option is not for this particular stream. The modular program is where students come to campus for blocks, and I'm going to explain it just very briefly. Moni later has a slide where he will explain how this particular cohort is working, but I want to explain the principle of modular and blended, and then he will deal with how it's going to work on the stream. So on a modular program, a normal generalist modular program, the student would have classes for 18 months, and the 18 months of classes is 8 study blocks of 6 days. And you would come to the campus for these study blocks, and you would spend a week on campus from Monday morning till Saturday afternoon, always until 5 o'clock on a Saturday afternoon, unless Pirates and Chiefs are playing, or Stormers and the Bulls, and then we try to wrap up at 4. And then you have an elective block right at the end of the program, and then somewhere within your second year, normally between July, September, and October, you will have an international study module where you will travel with a group of students to an international destination, to one of our partner schools. So that's a modular student. A modular student moves on and off campus. Essentially, you can say there's 8 normal blocks, there's 1 elective block, which is the 9th block, and then the international study tour, although it's not on campus, it can literally be anywhere in the world, and it's really anywhere in the world. We've had a group of students last year in Colombia, and we have a group of students next week in Boston in the USA. But it's also a week that you need to take cognizance of that you're going to be out of the work. The blended program also starts resident on campus. So the blended student starts on campus, but that's typically students that travel from far. So there's maybe the students that's logged in from far, and these are the students that says, 10 trips to South Africa. If you're traveling from Ghana, or you're traveling from Egypt, or you're traveling from Ethiopia, it's an expensive trip. So those students come to the campus for a 2-week block in the beginning of the program. And in their first year, they only have classes on Wednesday evening. On Wednesday evening, they would physically come to the campus. So you would sit on the campus for a class, or the classroom will come to you. So wherever you find yourself, if you're based in the Western Cape and you come to class on a Wednesday evening, and this particular Wednesday you're traveling, whether you're traveling to Johannesburg or to London, you log into the class and you attend the class. If you're traveling to China, you just log into the class in the morning, because if you didn't know, then it's evening in South Africa. And if you're traveling to the class and no, I've got that one wrong. But irrespective of whether you travel east or west, it's either going to be very light or early morning for you. But class attendance is compulsory. It's not what we call asynchronous learning. Asynchronous learning is you enroll for something, they put videos on YouTube, and whenever you feel like it, you watch the video on YouTube. You put it on 1.2 speed, because then it goes quicker, and then afterwards you do something. So that's not what this is. You have to attend the class. We record the class, and the class is available afterwards for you to access, but class attendance is compulsory. And the faculty can engage with you in the classroom, and you can engage with the faculty as well. And that's our blended program, a block in the beginning of the first year. In the second year, you again start with a block on campus. Then you continue with your classes on a Wednesday. And then in the end, you would also have an elective block. So even if you're a blended student, you will come at the end of your program, and you will join with all of the other students. So in November now, we've got, I think, 34 faculty members coming for 300 students, all congregating, whether they did full-time, part-time, whether they did modular or blended, they all come to the campus. So that's why all of these programs have a block at the end, and then of course a blended student would also do the study tour. For those not necessarily based in the Western Cape, especially those logged in online, you do not have to come to campus. So the students going to Boston next week. Some of the students are flying from Cape Town, some from Johannesburg, some from Windhoek, and I think one from Kenya or somewhere. And when I went earlier this year to Rwanda, the one student was flying from Singapore or somewhere. So wherever the student is, they just travel to the destination. We don't start on the campus, and we don't wrap up on the campus. We start and wrap up at our global destination. Right, so the delivery of the 2 streams, we've got 2 new streams, and basically Moni will elaborate on this a little bit later, but in your first year, you have the choice between these 2 modes of delivery, but in the second year, there's only 1 mode of delivery. And I will leave the detail for him later. He has a slide where he explains that. Now, what is in the MBA program? Again, I just want to contrast very quickly, because that's one of the questions that I've been getting continuously from the students. Again, Moni will go into the detail, and he will explain to you more in terms of the detail what is in the modules. All I want to show you here is that is our generalist standard MBA curriculum. And in there is two modules that will disappear. The one module is corporate finance, and the other module is perspectives on African frontiers. Now, those two modules you will not do when you do the healthcare specialization. So in the healthcare, where you had corporate finance, there's still a financial module, but now it's healthcare finance and governance, and we will deal with healthcare systems and policy. So those are the two that then become core of the MBA program. The two in blue, strategic management, remains strategic management as it is generalist. However, the application needs to be in the healthcare industry. So although you will do strategic management, although you will do it as a stream, you will do strategic management as done by other MBA students. But the cases and the applications and your assignments and your assignment you do, that will be in the healthcare industry. And the guest speakers that we typically get into that room will also be from the healthcare industry. So it is not different in credits and in structure, but in the detailed content it is different. And then the international study module, where we have the international study module where we're saying to the students is we're going to Grenoble in France for innovation, we're going for social entrepreneurship to Rwanda, and we're going to London for financial markets. There will be always at least one, depending on student numbers, more than one international study tour that is specific to this module to say we will go to Temple University, Fox Business School. They have a healthcare MBA, by the way, so we will go to them and we will collaborate with them on the healthcare, or we will go to Galway and we will focus on innovation and healthcare. So that stream will then be for this particular program. Right, ladies and gents, that's the difference in curriculum between the two programs. And I'm going to hand over to Moni. He will talk a little bit more about the particular stream, how it's being delivered, and then who we are targeting and the value that you're getting from all of this. Thank you.
Thanks, Martin. Chenin Blanc Pinotage.
I was actually wondering if I'm allowed to.
One glass of each. Very, very healthy per day, not more than that.
That's medical advice.
I will introduce you to two good ones if you want to. Our friendship is growing. Welcome here. I'm very excited tonight because this is something that we can do that is really, really worthwhile. It is something in an industry where last Thursday afternoon I spoke to doctors about training of medical advisors. Yesterday afternoon I spoke to the owners of the largest private sector HIV program in the world about how they have to deal with HIV clinicians. And tomorrow evening I'm going to talk to cardiologists about business ethics, on their request, by the way. And I'm going to talk about how do we afford expensive stuff in an economy like ours. How do we justify that you have to pay 74 million over a period of 5 years to prevent one breast cancer from spreading in 33 women versus not immunizing half of the Eastern Cape? Those are the questions that we have to deal with. And at the same time, there's genetics, there's wearable devices, there's interesting stuff happening. There's NHI that they want to bring in. That's actually just a funding mechanism. It's not a structure to deliver healthcare. And there's exciting stuff to do here. So the presentation is not that exciting. So you want to be an MBA, you want to be a leader, and you want to do it in health. You will get skills of strategy, management, business acumen, and you will have interdisciplinary interaction. I spoke to Pierre and said, you know what, Pierre, in my class, there was the guy who built the Hex River Tunnel. There was the CEO of a large bank. There was the first lady, no, there was the first person who was a lady who developed a computer system for private practices. And there was a guy who built diamonds out of coal and electricity and pressure and statistics. So you're going to deal with people that are highly intelligent. You're going to sit there and say, if they take me away out of this group, the average IQ is going to be 140. It is going to happen. It happened with me. When I added myself, the IQ obviously dropped a lot. And health is an area of rapid change, technologies, data, genetics, the developed world versus the developing world. We need to create value-based outcomes. What we are doing in health nowadays is, I think I'm holding a circular current. Is this better? Can you hear? Is that okay? Nelda, can you hear me? What is happening at the moment is that we are paying more and more for less value. We are paying 1.5 million rand for a drug that may give you 1.2 months of more suffering, or it may help you. And we need to get that delta V, which is the change in value space where the cost is back to value-related stuff, so that we spend more money on value and less money on less value. So if you want to be a leader, you've got to get into the situation here and you've got to do it. And believe you me, it can be done. It can be done, and it is exciting. So year one, modular or blended, your choice. Modular is 5 one-week blocks, Monday to Saturday. If you play golf, you'll have to shift your golf to Sundays. And then blended will be 1 2-week block with lectures on Wednesday evening from 4 to 8. 4 hours, Wednesday evenings. Just pray that Game of Thrones is not on the... but then buy yourself DSTV. I think we are sponsored a bit by MTN. Yeah. Year 2, 1 2-week block at the start of the year, blended classes for 6 months. Then the same time, international study module, healthcare destination. We have spoken about that, and then electives Saturday to Saturday at the end of the year. There goes Sunday. Specific modules. Health system structure and funding. This sounds drab, doesn't it? Can you believe that in the 80s we had a health system for 40,000 people where we managed 40,000 people with 5 doctors, 10 clinics, 53 mobile clinics, 3 mobile clinics for chronic disease, 2 social workers, 1 health inspector. And the 5 doctors had time to windsurf, to play squash, to play tennis, to do photography, and then we became bored and we started to do bird watching. You can do it, and you can do it in the developed world. When I visited that same place, and it is one of the reasons why I'm sitting here in '96, all of that was gone. The matron didn't know which doctors worked in the hospital. Interestingly enough, some of the patients that were there were long-term patients. They recognized me, and they asked me to come back. Not because of who I was, but what the system was when I was there. So health system structure and funding is a very practical thing. It is the dummy's way of managing a health facility or a health institution, and it is not rocket science. Health policy is changing. NHI is being pushed. I'm working with a very large medical scheme that is literally creating an option that will become NHI. We are starting to see the pictures of that. We are starting to see that it actually works. We are starting to cost it in that space. We are starting to model it while we work. Innovation in healthcare is massive. Since 2010, I personally led a team that evaluated more than 220 new technologies for funding. And we didn't evaluate all the new technologies that came out. Innovation in healthcare is taking place in many spaces. Many doctors are finding it very difficult to see a future for them. If I was a radiologist, I would be very worried. Why? Image recognition can do it better than I can. Then healthcare information management. If I look at the HIV program of the medical scheme that I manage, I have an HIV participants mart that has got more than 130,000 rows and most probably about 100 columns. And the next mart is coming, and that is the TB participants mart. And these two marts overlap. And I've got to make sense of that data. So except for the things that all of you know, Excel spreadsheets and pivot tables, we also need to know about data visualization and how do we use it and where do we go with it. Those things are very important. Generalist modules can do module assignments in healthcare, and will do the research assignment in healthcare. What are we trying to say here?
I slipped those last two in on Mani's slides. So when you're dealing with your generalist MBA modules and you are dealing with operations management and marketing management and all of those things, although it's generalist MBA, there's nothing that stops you from applying those assignments in your particular field. So the students would know that I can do my assignment in any organization. So even during the generalist part of the MBA program, you can still apply that to your particular context. And then what is non-negotiable for us is your research assignment has to be within healthcare. So currently, a current MBA student, like the students asking me if they can move over to this program, my response is unfortunately not. We're not legally allowed to. But there's nothing stopping you from doing your research assignment already within healthcare. But you're in this particular stream, you have to do your research assignment for us to endorse your final degree, not your degree, your final statement of marks to say you have an MBA with a specialization in healthcare. But there's a very broad interpretation of that, and we can discuss the details.
Great. So Nelda was sitting at the back there and who got honors for her health assignment. She didn't do it with me, but I was the person who had to give the final rubber stamp to that, wrote on the prevention of TB through isoniazid in babies with HIV. And she did a wonderful piece of work, but she did a general MBA. When I did my MBA, it was so-called MBA in Executive Health Management. I did all my assignments in the hospital where I worked. They didn't want me to do an MBA, by the way, but they got all the value of it, and I implemented every assignment in that space. So if you do this well. It is worth your while. So if you are not in the class of 2018-19, it doesn't mean that you cannot do a healthcare assignment if you want to do it. So you can talk to me if you want. Program gains: to lead responsibly, to function globally, to acquire expert decision-making skills, and to understand the interlinked roles of organizational departments. Very interesting. In Tygerberg, we had a problem with consumables. Nelda, you might learn something from this. They came to me and said, we have a big problem. There's a 30% escalation in costs in consumables. How are we going to manage it? There are 1,100 different types of consumables here. In those days, we didn't have anything on computers, so I had a big book, sat for the weekend, put everything in Excel. At the end of the day, I found out if I managed 15 of those consumables, I managed 60% of the costs. If I managed 5, I managed 30% of the costs. If I managed 30, I managed 80% of the costs. The costs that I had to manage were not the costs that the professors told me to manage. They said, don't use this, don't use that twice, use this 3 times. That wouldn't have made an inkling of difference to the costs. We just created a filter in the renal unit that caused them to use less filters in the hemodialysis. We saved millions. Our costs were controlled the next year. You can do that. So understand the interlinked roles in the organization. If I didn't listen to a guy with the name of Karel Grobler who was heading that up, that assignment would not have gone where it went. What value can you expect? And I basically sat down when I penned this down and said, what did this do to you? What do MBA students that I work with tell me? You get out of your siloed thinking and you become a broad thinker and you understand health in many facets. You will definitely grow as a person. You will get to know yourself in very difficult circumstances. You will get to know yourself in elation. You will get to know yourself when you are tested in a strategy game where people can get very serious. Sort of stand-up argument type of serious. You are the hospital manager, Nelda, and you are not Mediclinics. And you have to negotiate the price of a hip prosthesis with somebody else. And there's role play and people want to win. Why? Because somebody told you that your marks depend on what you do. And I've seen people stand up and argue with each other. I've got a photograph of it. You'll get very, very wide insights. You'll move out of your comfort zone where you are. And you will see that there are other areas where you can also be comfortable. You will build networks of knowledge and networks of real interaction. And it will be your launchpad for success. Success that must be contributory, because that is why we are here. We are born with certain capabilities. We were put in situations where we could develop them. There's nothing to be arrogant about. So you can launch contributory success from this space. And you can also launch personal success, whatever way you see it, out of this space. We'll find value. Clinicians, general practitioners, health professionals, managers and professionals from different disciplines in and outside health, private sector, pharmaceutical, health technology businesses, regulatory oversight, other organizations such as SAMA, Health Professions Council, Hospital Association, etc., senior people in public sector positions. Due to the fact that I did an MBA, I got an offer to move into head office, into a fairly senior position, before I finished my MBA. I applied my knowledge in the place where I worked. The public sector said, okay, so we now recognize your MBA. You can move forward. Senior nurses in the public and private hospitals who lead large teams. You see, we know that those people manage, And then health insurance specialists, and medical aid specialists, and underwriters, and claim processing team leaders and managers. Those are the people that we are looking for. You can grow here.
Thank you, Moni. I'm handing back to Owen.
Team, do we have another mic? It's question time. So we'll go around. Just speak into the mic because of the people that are streaming. So any questions?
Good evening. Please forgive my voice. It's a bit husky. Okay, my question is with regard to the entrance requirement. I've seen on the screen that you've mentioned that someone shall have NUF, I think level 8 or NUF 8. So if someone has a BTech in mechanical engineering with 10 years experience, where does that kind of a person fit in your structure?
I thought your husky voice was just for sexiness. Thank you. The reason I don't put that on the slide is we have a process, but it's a very popular process. Legally, in South Africa, we are allowed to do recognition of prior learning. Now, the BTech degree is an NQF level 7. And if you have a BTech degree, there are two ways to get access to the MBA program. One is to do a postgraduate diploma in business management and administration. So we have a fair amount of students that first do the postgraduate diploma in business management and administration, which to an extent is the first third of an old MBA program. Or you could ask for recognition of prior learning. And the recognition of prior learning process, you've nailed it. You need to have at least NQF level 7, and you need to have 10 years of business experience. Process is slightly different. You still do all of the same things, but then you have to provide us with 2 academic references. Apologies, 2 business references. We follow up with the business references, we get the details, and then we invite you for a recognition of prior learning interview. And the recognition of prior learning interview, the intent is to ensure that you have already within the 10 years of business experience gained the same kind of knowledge that you would have gained had you done a postgraduate diploma or an honors. Last year, I know now off the cuff because we needed to give it yesterday to Amber. Last year, although we are legally allowed 10%, 4.6%. So 4.6% of all the current 2017 MBA students came through that particular route. I said, we're not going to go the PG Dip route, we'd first like to do that. So that is available, and on the website it's actually very comprehensive to explain that one. And those students are very successful as well. The other option that we have, sometimes you have students that don't even have BTech or a 3-year B degree, and those students we can go through an RPL process as well, but only for the PG Dip. So if you have only, if you haven't done any formal completed qualifications, then we could also do recognition of prior learning up to an NQF level 6, and then you have to apologies, up to an NQF level 7, and then you have to do the PG Dip before getting to the MBA. If you don't get this NQF or all of these things, Mari is the person you need to speak to before she disappears tonight. Any other question?
Hello. For a scientist, where you will do a PhD, and then after that you'll do a postdoctoral fellowship, will that postdoc be considered experience, work experience?
The question for those online that didn't know it, that a very typical career progression in the sciences is where we'll do MPhD, and then after the PhD a postdoc, and whether the postdoc will be accepted as experience, and the answer is I don't know. I think we will have to look at exactly what was done in the postdoc. My gut feeling is yes, because as a postdoc, you know, your industry is academia, but you are working within academia, and there's no significant difference than a person sitting in a particular technical stream and working there. The truth is, I don't know, but I think it would be, and that's a typical thing that we can, through our processes, we can check for you and we can let you know. Yes.
I think that one will even stump Omari. Any other questions?
So it's just a bit of a follow-up question to my colleague as a postdoc, and if you follow that up and do another master's but in public health in a stream in epidemiology, and then you want to expand further and do an MBA in health leadership, is that possible?
Jesus, Martha. Good luck.
I can think of very few people who have come to where you are who have not interacted with or led smaller or larger teams. So in the interview, that type of discussion will most probably come forward. I told Pierre that one of the reasons why we do MBA is because we share knowledge. And I am very, very sure that the other principle of how we teach, where we say we're not the sage on the stage, but the guide on the side, who learns from students, is going to become true if you guys make it into the course. But I think we need to look at this at an individual level. My gut feel says that if you have come where you have come, that you had a lot of interaction with teams, either research teams, whatever, and that you, in some spaces, were the leader of that team. So, more information, not a no.
Can I explain just very briefly where the 3 years come from? I teach in India and I teach in America. And the business school in India where I teach, the average pre-grad of the students sitting in the MBA classroom is 87%. So if you don't get 87% for your B degree, then you don't ask to go into an MBA in IMT business school. However, the students that you're sitting with in the classroom is boring, and the learning is not between the students. They have completed their B degrees and they start with their MBAs. So I walk into a classroom, I teach to them, they're absolutely brilliant. They write down what I tell them, and when I test them, they tell me what I told them and what is in the book, word for word. They're absolutely brilliant. When those faculty come and teach at Stellenbosch, they say it is a fantastic place to teach due to the experience of our students. So the answer to your question would be for me is what we don't want is we don't want the typical USA model and India model where you do a B and then you do an MBA, because then the learning in the classroom is extremely poor and the learning is from the faculty. If you've done a postdoc, you've done multiple degrees, you've worked throughout, it means that what you bring into the classroom is as valuable as the person that facilitates within the classroom. And I think even when we have a unique situation, that will be the guiding principle. The guiding principle for us would be is, are we admitting the person into a classroom? And that's the 10-year work experience, because even if you've studied nothing, but you have 10 years of work experience, you have a huge amount to share in the classroom. Sometimes if you've studied for 4 years, you haven't worked, you have not a lot to share in the classroom. But we will have to deal with it individually.
Problem-based is becoming a bit of an academic swear word, but I still believe that adult education is very problem-based. And if you throw problems to students, prior knowledge and prior experience is what they learn from. So again, I say it's not a no.
Thank you. I've got 2 questions. One is with regard to the healthcare. I think the MBA said the healthcare leadership, but on the modules that were presented there, I didn't see anything on leadership or things on leadership, and which and it's mostly healthcare leadership, which is it needs to specialize in the leadership of healthcare, or it has to have something that has leadership, which will help those that are in healthcare to lead in healthcare. That's one. And the second one, you said that those that are already doing MBA, they are not allowed to jump into this one. I'm currently doing MBA, but in another university. But I'm finalizing the thesis. But when I saw this, it sort of interested me because it's in my field, and the MBA that I'm doing, or the old MBA, when now there's this healthcare leadership, it feels like it's nothing compared to what is going to be presented here, or what is going to be taught, which is something that one was looking for in doing MBA in the first place, because one needs to be a leader in the healthcare. So I don't know now how do you place someone there that mostly just the specialization in healthcare that sort of need those, because those things are not there. The the governance, the health systems, they are not there in the previous MBAs. So how do you place that person? How can one benefit from this MBA?
There's Johan here and there's Nelda here. We have done MBAs. I did my MBA in healthcare management. I did it while I was a deputy CEO at Tygerberg Hospital. Met Mr. Mandela there. Very impressed. Definitely more than with Mr. Yeah. Okay. In my space, it taught me how to manage at a different level, how to lead at a different level, how to plan at a different level, how to strategize at a different level, and how to see things in total at a different level. I would not have had those insights. You have a very specific problem, and maybe Martin can help you with that. The leadership is woven into the course as you go along. It is a theme. How do you plan, organize, lead, check, do what you need to do?
Thank you, Moni. Just very briefly, we're not allowed to switch any current students over to that program. That's a legal thing. To get any new program into South Africa in the system takes about 3 years. So that's just the reality. And some of our current students sitting there at the back have already cornered me and said to me, why can I not do this? So unfortunately, if you're not currently within the USB, there's precious little that we can do. So that's a sad reality. For existing students, because I know there are existing students, we're not allowed to switch them. But what we are doing from 2018 is we're opening our elective modules for alumni. So USB alumni, so even if you graduate with a USB MBA next year, like our students, the year thereafter, you're more than welcome to come and do a selection from these things. And that will remain open for all MBA students. So if you're keen in terms of innovation in healthcare, which I think Moni will personally do, then you come and do that. And if you want to do a one on data visualization in healthcare, then you can do it in the same year or the year thereafter. So we have made provision because we've already picked up very quickly in the market. There's a fair amount of our students on the generalist program as well that would like to. This year we've got Helena Michel from Grenoble in France coming to do serious gamification for us. And there are students that graduated the last 10 years that do that. So that's the one thing that we've opened. The second question is leadership is part of the generalist program. So you didn't see that as a module specifically, but you will see on the curriculum there. So the leadership is not tailored for healthcare, but the leadership is very, very personal orientated. But the reflection and the application thereof is within your own particular space. So if they ask you to go and reflect about that, it would be within your space. So the most definite leadership will still be very, very important. But it starts in the first year of study. So within the first year of study, the leadership sessions will actually be generalist. In the second year of study, although it's still exactly the same context, it will be in the stream. So you will have smaller classes and it will be in the healthcare stream. But it's still the exact same content in the leadership module. Ladies and gentlemen, I'm aware of the time and I see 2 online questions that I want to address very quickly. After that, if you have a general question that would have interest for everybody, just indicate to me and I'll allow one more generalist question if that's okay with you, Owen. And then we will wrap up and we will not disappear until all of the specific questions are being asked. So there was a question from Ina in terms of the deadline for application. Amber said work towards the middle of November. I think our formal deadline, Francis, you will know that. Is that 13? Formal deadline for applications is 30 November. My recommendation is to get it in as soon as possible. And then the second one, is there a discount for staff from the medical school campus to get any discount? According to me, there are 2 components of the studies fees. There's a component that is central to the University of Stellenbosch, and there's a component that is from the USB. This is not my area of specialization. Francis, will you be able to provide more details? So the answer is yes, there is, but it's not a percentage of the total fee. It is a large percentage of the central fee.
Oh, brilliant. You can see Frances has done her MBA. She's not going to take your question. She says, Sean Davids at main campus, he is the person. But the answer is yes, but just be careful. I know I had one unhappy student 3 or 4 years ago that spoke to Sean, and the answer wasn't accurate. Sean said yes, and the yes was for a component of the fee. Then I have, if someone can contact me, please. I've not had successful response. Do you have a contact? Okay, so Nadaya, we will get somebody onto you. Email tomorrow. There we go. Maria's already done that. Sean Davids was unable to help. Okay, so that unfortunately is a University of Stellenbosch employee. What I can tell you is that the Mari Willows email address that you have there I've never in my entire life heard that Mari Willows is not willing to help. So even if that means driving over in her 1994 Fiat Uno to Sean Davis's office and strangling him. Thank you, Francis. Truly appreciate that. Okay, I saw a hand there at the back from, was it Nelda? Nelda, you have a generalist question.
So perhaps it's more a general comment rather than a general question. And I think reflecting on some of the questions that the audience members have raised. So I did my general MBA at Stellenbosch University. I completed it in 2014. Background is I'm a clinician. I did a master's in public health. Felt after that, I can now, see the future, but I don't know how to make it happen. And that's why the MBA intrigued me. From a leadership perspective, I would say that's probably 50% of the value that I got out of the general program. I mean, obviously, I was working in the healthcare industry at that point in time, so I opted for, except for all of the group assignments, to do all of my assignments in healthcare, and it was hugely beneficial. The reality is that today in healthcare, as we stand, we really need leadership. So I think if that is your focus, the boekenkennis, the academics, you are probably fairly intelligent as it is because you are where you are. You can come up with some of that on your own, but the thinking amongst peers, the sort of challenging your own little box, challenging your, that really brave yet responsible but out of the box thinking leadership is what healthcare needs right now. And from a personal experience, I got a lot of growth out of this specific program. And I think if you spend some time with yourself in terms of understanding why you are engaging with this idea of doing an MBA in healthcare leadership, first sort of establish what your reason is for trying to do this program, and then go and try and tick the boxes. From a leadership perspective, you will get the value. If you put in the miles and you engage, you will get the value from this program. And in my opinion, that's what healthcare needs right now. That was unsolicited, by the way.
We didn't pay Nelda to say that and to be here, but she's very strongly on our radar for a potential faculty that I know.
Okay, ladies and gentlemen, I think for the rest of the evening, there's some food over there. A lot of people did not show up, so you're going to have to eat all of it. Yeah, I think some of the value also is in staying and engaging with people like Martin and Mani afterwards. So stay and engage them, ask them some of the questions that maybe perhaps were not aired here. And of course, Mari is here as well. So engage and ask questions. Thank you very much. And when you drive home, please drive home safely. Thank you.